Go ahead and start the meeting now. I do want to acknowledge that we are on the ancestral lands of the Confederated Tribes of the Colville Reservation. Everywhere that we walk, everywhere we go in north central Washington was once the ancestral lands and ceded lands of the Colville tribe. And we honor them with gratitude and accept them as our partners as they bring to light their cultural heritage. So I wanted to just get that out there. And we are also again once on Zoom. So there is Zoom etiquette. We prefer that you leave your cameras open so that we can see your faces. It tends to make us feel like we are more together that way. It was great seeing everyone who was able to go to the retreat, though. That was a nice chance to get to actually side hug people. At this time, I'll go ahead and do roll call. So when you hear your name, please say here. Carlene Anders.
Yes, I'm here.
Kathy Moret.
Here.
Deb Murphy. I think she's here. She's just muted. Yeah. Dell Anderson.
He is going to be late, Molly.
Okay. Jesus Hernandez.
I'm here.
Thank
and
you.
I'll get back in camera once I'm done stuffing my face.
Oh, good. I get it. I get it. Yes. All right. Ken Sterner.
I'm here.
All right. Ramona Hicks. You said something in the chat. Oh, okay. Okay. All righty. Thank you. Ray Eichmeyer.
Here.
Rebecca Davenport.
Here.
Rosalinda Kibbe.
He did email a while back. She's absent today.
Okay, very good. And Senator Warnock is absent. And Dr. Tuggy, Michael Tuggy. And Kat is going to be absent. She'll let us know. Teresa Atkinson.
Here.
Okay. Nancy Spurgeon. Maybe. And Peter Morgan. All right. Go ahead if we get them to come in or see them, I'll add them to our roster. And at this time, is there any declaration of conflict? You've all had a chance to review the agenda, know what information is going to be on the agenda. So if you have any conflicts at this time, please let us know. Otherwise, during the meeting, if you feel like it might be a conflict, please just let us know. You can put it in the chat and then we will acknowledge that in the minutes. Do we have any guests that would like to have a public comment or go ahead and put your name and organization in the chat? I also invite the staff to put their name and position in the chat so that we can reflect that as well in the minutes. The consent agenda is an approval of the agenda, the acronyms, the minutes from the June meeting, and the monthly financial report. Thank you, Linda. Hello. Pages 1 through 21 would be the consent agenda. Give everyone a chance to look through their copies, and then I will entertain a motion for approval.
This is Carlene. I'll move to approve.
Thank you, Carlene.
Second.
Thank you. And any comments, any questions about the attachments? I will acknowledge that I did send out some documents for board members only to review. That was just a short time ago. They will not be reflected in this piece though. So I have a motion and a second. All those in favor, please say aye.
Aye.
Aye. Aye.
Any opposed?
Aye.
Opposed would be nay. Any nay? No. Any abstain? All right, then motion carries for the approval consent agenda. Now we'll be going forward with John's report. So I will shush.
All right, welcome everyone. And as we were chatting prior to the call, we hope everyone is staying cool. There's a few of us who may have had air conditioning malfunctions in the last couple days, and Molly, you are not the only one who has had an air conditioning malfunction. So there's plenty of people out there who are enjoying the heat. And also, you know, I always want to recognize we're lucky to have air conditioning this day and age too, because I know some people around do not have access to air conditioning and are looking for places just to stay cool and find a way to kind of take a reprieve from the heat. So I always want to recognize that, you know, it's a blessing to be able to have air conditioning in our households. So a few quick updates, just statewide and operational. As a number of you know, at the last meeting, the last meeting in June, we approved submitting a public comment for the MTP waiver renewal. And the healthcare authority did submit the waiver renewal in July. It is currently open for federal public comment, which I just learned today, and I'm not for sure how much comment comes in at the federal level, but CMS has it open for federal public comment. And then the healthcare authority will continue to update us as we go along with the waiver renewal. With the CHART model, and CHART stands for Community Access and Rural Transformation Model. Again, this is a healthcare authority grant that they have with CMS to look at rural healthcare payment transformation with the geographic area in the North Central Washington. And so they're partnering with it's the 3 Okanagan hospitals, Mid Valley, North Valley, 3 Rivers, and Confluence Health right now. And the ACH is acting as a co-chair on the advisory council. I'm looking quickly, I see Ken Sterner's face. So I know Ken Sterner's on the advisory council as well as Jesus. So a few board members as well. And so we're continually to track that. What I can tell you is that the hospitals have received from CMS the current alternative payment model, and they're evaluating that. If I'm going to be blunt and honest, it is not anywhere near worth signing on to at this current juncture. And I think the hospitals have been pretty honest about that with the advisory council members. And, you know, it just doesn't even get them up to par to what they get reimbursed for Medicare now. And so I think there's going to be some discussion and evaluation to see if those can be adjusted, and if not, what next steps could be done. At that same time, the advisory council is going through creating a community transformation plan, which is a step that needs to be done as part of the CHART model. And it's been sent out to advisory council members to be signed August 8th. So still know that the work that we're doing under that grant is a little bit unknown until we really understand what some of the payment models are, and that members of the advisory council are looking at a community transformation plan application that we are submitting. A lot of these next steps are really going to be determined based on that payment model, and so there's going to be a level of wait and see for that, and we'll keep the board up to speed on that as well, just because, you know, payment reform is something that's been under the first Medicaid waiver, and it's still something we continue to track and be part of. This Wednesday, the interim CEO, Jim Crawford from the Health Benefit Exchange, is going to be coming to Wenatchee to meet with our team. I sit as a board member on the Health Benefit Exchange, and he is coming out just to see North Central Washington and meet with some of the local board members. And we're taking the opportunity to do a little bit of a bi-directional education session with him so that he can share a little bit with our team about the Health Benefit Exchange, and we as a team can share a little bit to him about accountable communities of health. And so He'll be out here. We're going to do a quick lunch, get to know you, and then a little bit of time to learn about each other. Operations, just a few quick updates. We are going to be starting the 2023 budget process in August with Clifton Larson Allen. We've been working with Sarah Krosky and Kristen Solberg there, who have been our assigned accountants with our contract with them. We are going to be looking at multi-year budgeting and how we look at some of our programs more than a year at a time. We're going to be looking at if we could consider multi-year contracting, things that we can do to be a little bit more to project out our budget more than 1 year at a time. And then we would also be looking at how we would present that information to the board as well. So we're getting that kicked off in August. You can expect to see some updates over the next few months. On that same note, just operationally, we're discussing with Clifton Larson Allen right now to also update the contract with them so that Sarah can provide more CFO controller level services and more robust level of services to us. And so as we go through and look at the costs associated with that and that contracting, what you could see is just an update of that change, as well as in the future, Sarah Krosky might be more involved in board meetings as she takes more of a financial lead role in the organization. Lastly, Morgan's been working with Simple Power IT to do updates to our website. We've been slowly doing it on the back end, and our primary contact with Simple Power has been out on leave, just taking care of a surgery issue. And so you guys should actually probably in the next few months see a little bit of a tweak and update to the website as well. And you'll kind of see those changes go through. And maybe once we get that really refreshed and finalized, we'll find some time at a board meeting just to do kind of a quick show of some of those changes and what you can expect with that. A few things. Again, we always kind of want to come back and just give you guys some quick updates on our 2022 strategic goals. And this is all 5 of them, again, listed that we shared with you before. So a few quick updates on our 2022 strategic goals. Friday in the newsletter, we released our community equity funding, as well as we did an independent e-blast today as well. And that's really looking at funding organizations that are trying to build a culture or grow their understanding of equity in their community and in their organizations. And so that application process has gone live, and you should be able to see that in your emails today in that independent e-blast. As well, just as always, just as an example, we're trying to, any kinds of materials we kick out and utilize, we're trying to partner with Karen Francis McWhite, who is our equity consultant, to do a review, and the materials that you see today for the board application that Ken's going to be presenting included some adjustments and reviews in that. And then finally, we are partnering and working to partner more with the North Central Washington Equity Alliance to look at how we build out equity trainings across the region. And we are also partnering with them to provide additional capacity funding so that they can bolster up. They had a part-time FTE executive director so that they can bolster that to a full-time position so that they can really dive into this work in our region. On the second priority around promoting whole system response, this is just kind of a reminder that we created a cross-sector partnership application funding a while back ago that opened up, is still open. If Caroline, can you dump that link in the chat? If you know anyone interested, feel free to share it around. Caroline is our lead on that, and so she is happy if you want to connect in a partnering organization or someone you think who would qualify that. If you'd want to connect them with Caroline, she would be more than happy to have a conversation with them to see if they have any projects or ideas that fit with this aligning with this funding opportunity. I will say we are really trying to emphasize that cross-sector partnership, and that these are applications that build on that partnership between 2 organizations. And so we really want that focus to be how are they finding that alignment and building that partnership as much as possible. Teresa, I see you have your hand raised.
Yeah, real quick, since it's not part of your report, do you guys have a timeline for when you're going to start releasing some of those funds?
It's a rolling application, and Caroline, I may have you answer that question. Do you have an expectation when partners will hear back on funding?
Yeah, we're still recruiting for our review committee, Teresa. So for this is specific to the cross-sector funding application, but actually the review committee would also be involved in the equity funding. And hopefully we will have those members recruited in August. So I believe decisions could start being made starting end of August into September, just to be realistic. We're going to need to do some strong orientation of that review committee. So there's still a little bit of work ahead of us, but does that answer the question?
Yeah, can I make a recommendation that you let the applicants know your timeline for that? Just for internal planning, when you've got a proposal out there and you're trying to plan for staffing, I think it would be helpful if folks had at least an estimate, even if you just said this fall.
Yeah.
Perfect. On behavioral health and recovery front, I know telehealth actually falls a little bit between behavioral health and capacity building, but I just wanted to note that Wendy and Christian from Ingenuum went last week on a tour of telehealth across North Central Washington, meeting with a variety of partners. I know there's a number of board members who are also part of those meetings. I think Jesus and I know Dell, but I don't see Dell's picture here. Ray, I don't know if you're part of the conversations up in Lake Chelan Health as well. But they met with 7 clinical organizations as well as 4 community-based organizations, looking at, again, how are we building out our telehealth optimization in the clinical organizations and how are we partnering with the community-based organizations, including, can't believe I forgot, Kathy's shop, North Central ESD, and integrating it in schools, as well as North Central regional libraries, and how are we partnering with the libraries to provide some of these services. The behavioral health stakeholders group, I just wanted to call out, has adopted 3 primary initiatives. One is focusing on integrating a mental health individual in the regional library systems. And they're looking at doing a pilot in Grant County with the regional library system and Renew. They're working with emergency departments to treat behavioral health the same way that they would treat a stroke patient. And so how are they building that system of care around the behavioral health patient in the emergency department and providing them those needed services? Similar, as we all know, when we look at acute services like a stroke, how the team and how that wraps around that stroke patient to make sure that they get that care. That pilot is being looked at being started at the Confluence hospitals. And then the third initiative was really looking at how we've in care coordination with behavioral health. And so that's going to be an expansion or a partnership with the work Caroline has been doing around community-based care coordination, and how are those 2 discussions really wrapping together. And then last, I just wanted to call out and give a shout out to Beacon, who did provide another $60,000 as part of that substance abuse block grant funding that we have received to do Narcan vending machines. And so we are placing, or have placed, Jolie, you'd have to confirm that for me, a Narcan vending machine at the Rural Resources in Grand Coulee. Molly, you could confirm that for me too.
It's in the mail.
Yeah.
It's in the mail. It's just, an envelope headed your direction, right?
A very big one.
Yeah. But, when we think about just funding sources and the way we do funding outside of the waiver, through this work that we've done with Beacon, we've been able to get $220,000 to support Narcan vending machines as part of those substance abuse block grants. It's not a large portion of our budget, but it's just an example on how we can start looking at different funding sources to help achieve those objectives we want to do as a region. Under policy work, I've been spending July and August meeting with a number of our local legislators for the state of Washington, as well as county commissioners, sharing a little bit about what the ACH is, or getting them up to speed again about the accountable communities of health, and also just making that personal connection with them and figuring out what their priorities are for this next legislative session. Knowing that, of course, a number of our local legislators are also running for re-election as well. August 29th, we're going to be holding our first joint 5 MCL meeting with North Central Accountable Community Health. Again, looking at how we can work with the MCOs to align on some of these initiatives moving forward. And then just across the ACHs, we're working on joint policy statements that we can work on across the 9 ACHs, as well as how we can formalize our current statewide ACH collaborative that we have between the 9 of us, with the ultimate goal really of creating our own ACH voice at the state level, either with legislatures or partnering with statewide entities, so that we're not just seeing through the lens of the healthcare authority. And then just a few other things to update on under capacity building. I wanted to call out that the staff has been meeting with the Community Foundation North Central Washington, who also has the Nonprofit Institute across North Central Washington, on ways that we can partner with them on providing capacity building training, as well as looking at ways that we can do capacity building training ourselves. I know we looked at some of the summary at the board retreat, capacity building came up a number of times, and so it's going to be important to see how we infuse that into our work in the future. I wanted to call out the work under Hope Squad, and they had released a second video, and so you can see the link right there, and that can get dumped in the chat. So if you're curious on the second Hope Squad video, I encourage you to look and watch that as well. It's about 5 minutes long, so it doesn't take that much time, and it's a great way to kind of see what's going on with that project. And then we've been also just looking collaboratively how we can share our space. We're lucky to have a nice conference room here at our office, and so just an example is Parque Padrinos was able to utilize it during a board meeting this last July. And the staff is really looking at what are some ways that we can structure allowing more community organizations to utilize our conference room space without, making it the sole focus of our organization, knowing that we want to be flexible because organizations meet at varieties of time depending on their board. So we're going to be looking at that, and we'll be able to share more information in the future. And then lastly, our next partner convening is August 23rd, 10 a.m. to 12 p.m. And we'll put the registration link in the chat. So if board members who are interested in attending, the link will be in the chat. Any questions, comments?
All right, then.
Thank you all. I will turn it back to Molly.
Thank you. Thank you, John. All right. I was just checking to see if Christopher Kelleher is here, and he is. So at this time, I want to invite him for the board retreat debrief and the community engagement outline. So Chris, take it away.
Hi, everyone. It's good to see you all. So yeah, as you'll see on the agenda, we're going to start with going to debrief about the retreat, sort of going to go over some of the main takeaways from it, and talk about one of the activities that's sort of a spinoff from the retreat that we're starting related to community engagement. We'll take a break, and then we will talk about the board survey, and then just talk more broadly about the board, where we want the board to go, how it can improve, and hopefully do that in the light of the discussion, the first discussion about the retreat and everything like that, learning from that experience. So I'm going to do a screen share. Okay, so first, we have a detailed work plan. We also have this view that you're looking at right here. We take some of the main elements, and we've looked at this once or twice before. I want to come back to it, sort of to kind of show you where we are. In the left, you see in bold were things for June and July. That period is now over. We've now moved into what we're calling the summer and the fall. the first one having to do with sort of getting ready to develop the regional compact. We've talked about the regional compact a couple times. It was a discussion point at the retreat. We gained a lot from the retreat, learning exactly what to focus on. And we've had discussions also at the strategy work group level about what the key components of the compact need to be. You might remember in our, I think it was our June meeting, we talked about levers, for instance, like what are the levers that we could use? So those sorts of things helping us get ready to do to prepare the compact. Talking about distributed leadership, that also was a focus was something that really came up at the retreat. Whether we were using those exact words all the time or not, it still was sort of one of the undercurrents. Assembling and launching a learning task force, which we have done. So we had, I will show you in a sec about that. We are preparing to launch a measurement task force, and we've had preliminary meetings to help scope that out. And then we're just broadly just like figuring out where we want to go for the rest of the year. So that's where things currently stand. You can see if you look in the final column, sort of where we aim to be with each of these things by the end of the year. Any questions about this before I move on? Okay, we can always come back to it, and you'll have a copy of it in your packet. So I mentioned the learning task force. So we had our first meeting last Monday. Hold on a sec. Whoops. Okay, first meeting last Monday. It was great. It was a really good first meeting. You can see the membership of the task force right here. Some of our people you already know. Is Nancy on the call today? Okay. Well, Nancy was there. She's one of the members. She was one of the board members who's part of the task force. And it was just as you want a meeting like this to go. It was. We ended up in a different place at the end than we were in the beginning. We had a really, I thought, a very productive discussion about what does it mean to have, like, where's the value? Several people kind of raised the point, like what's the kind of thing that makes people want to show up for something like this, for learning sessions. Just to kind of the broad recap here is that we started the year with learning sessions that sort of a core group of us determined to sort of lay a foundation, talk about key, really core concepts. But for this now going forward, we really want to have it be more sort of have the community, crowdsource it and have other people really help us determine what our focus ought to be. And we had a good discussion at that meeting about what that means, what shape that takes. The number one takeaway I'd say is that we really identified what the most valuable thing is to figure out what are the problems that need to be solved. Like what are the things that people are wrestling with, that they are having trouble with wrestling with alone, and they would love to hear more and to talk with one another about. And so trying to structure our agendas that way, and be fairly fluid with them as we go through the year, so that we're, if you have a good meeting and an issue comes up, you're like, wow, that's an issue we hadn't thought of before. Okay, maybe that's the subject for the next meeting, and to really be responsive to whatever the current most pressing needs are in the region. All right. Okay, the retreat itself. We just, for those of you who weren't there, or for those who've already forgotten because it was 3 weeks ago, here we had a morning session, and we had an afternoon session. We talked a lot in the morning session about what do we know about collaborative networks, how do they work. We'll look at a slide in a second that kind of talks about that, and what are the trade-offs and the costs for different stages in the continuum. And I'll show you a slide about the continuum to refresh your memory about that. And then, we talked a lot about, what's our purpose, what's our identity, what are we here for? And then in the afternoon, we had a really robust discussion about equity and how that fits into the larger picture. So let me show you. We did also, just to show, we did a plus delta exercise at the end. Basically, plus means what would y'all like? Delta means what would you like to be different in the future? The on the left there and the blue on the bottom, the safe and constructive space that we created is, like, to me, is the most important one. Like we modeled well how to do that. It was the consensus that we had succeeded in creating a safe and constructive space where people really felt free to say what was on their minds. And that's what you want. So that's good. That's a good model that we can carry forward. Okay, so you can see what some of the main takeaways were. I should mention that Caroline is preparing an executive summary about the retreat, which goes into a whole lot more detail. So particularly for those of you who weren't there, you'll be able to really catch up on the main things. So I know Caroline's working on that, and that'll be hitting on all the main points. I do want to talk about though the continuum exercise. And so we shared this, many of you have seen this before, even if you weren't at the retreat, basically trying to understand that when you're doing this kind of work, that there is a continuum of progress. You have networking, which is kind of about awareness and exchanging, where people come together and they share information with one another. And then you move to coordinating, and then to cooperating, and then to collaborating. And so the key thing there for me, like from my perspective at least, is to understand, like, you don't have to do all these things at once, and it is kind of a progression. It's hard to move straight to collaborating if you haven't even done any of the other things yet. You kind of have to progress through these things for the most part. And so what we want to do is to see, like, if for the different things that we care about, where are we as a region? Like, what do we already, if we already have a lot of awareness, if we already have a lot of good information exchanging, then we can kind of concentrate then on, okay, great, how do we move that into coordinating and so on. One of the takeaways from this was we did a post-it note exercise, and Wendy very helpfully took all the post-it notes and put them onto this, it sort of digitized them. So you can see a summary of what we had, of what people put up on the board for. We looked at one of our pillars, which is anchoring and shared measurement, and said, okay, in the networking sort of information exchange awareness column, what are the things we could do that would be effective? Okay, now if we were sort of in the cooperating zone, what are some things that we can do? And then eventually, once we're really robust and know what we're doing, and we're collaborating, we're really doing the really most ambitious kind of networking, what are some things that we could do? So this is a valuable resource, and this kind of thing that we'll return to as we figure out what we want to do at different stages. Yeah, let me show one more slide, and then I'm going to stop for comments. So altogether, and there's good energy and excitement about whole person health and health equity, an understanding of the pillars, still ways to go, but we've established the pillars, we've had them for a while, still learning how to like, live into them and make them operational, but making good progress. And a strong commitment to building relationships, and then shifting mindsets, and advancing health equity. Those are the things that's the sort of where the progress part of it. And then we also have on the other side, we talked about what the needs are. Okay, so where do we, great, those things are all nice. What do we need? What we need is a more robust network game, and really think, what would it take for our region to thrive? If that came up at several points during the retreat, if we want to thrive, what's it going to take? The pillars need to evolve, and they're a really good starting point. They've really gotten us going, but they need to, nothing stays still in this kind of work. You're always trying to evolve and to advance. So where do we need to go next? And then, and I should say, like, of the three pillars, and this is, we kind of always knew this, like the third pillar, as you may recall, first is about distributed leadership. The second is about measurement. The third is about building a regional portfolio. And there's a lot of agreement, like, well, that's the hardest, like, what's that mean? Like, how do we do that? What's that all about? That's understandable. Like that's the more advanced one. That's what you're eventually building towards. So it makes sense that that's right now the least well-defined. But what we want to do is start to make it more defined, and start to figure out exactly how we want to achieve that. The regional compact is one of the steps along that path. If you want to form a regional agenda, you have to, one of the necessary steps is to bring people from the region together, so that you're hearing from everybody and people aren't left out, and people really feel that they're engaged and they understand and they start to feel a sense of mutual purpose and so on. That's what we want to start doing with the compact. And then the compact, once you get a group together and you start to build trust and mutual understanding, it then becomes easier to understand, okay, what's a portfolio we all want to work on together. And I should say the other one of the main other things we talked about is I forget who made this comment, but it's a helpful way of framing this, that when you think what's in the regional portfolio, what's in it are the things that no organization can do by themselves. Every organization has goals. They all have things that they want to do. They all have initiatives and so on. But some initiatives are too big for any one group or institution to do by themselves. You need help. You need to combine efforts with others. What are those things? That then becomes the foundation for the regional portfolio, where we're all coming together to collaborate to achieve things that are too big for any one group. And then finally, just finding ways to integrate capacity building in meaningful ways and build our muscles, our civic muscles, our equity muscles, and so on. Okay, I want to stop right there. We'll talk about, we have a plan for community engagement. I'm going to talk about that next, sort of like say, okay, how do we start to, what's the next step for making some of this real? But I want to pause here, ask the people who are at the retreat, or those who weren't, to comment on anything I presented thus far and any takeaways you have, including any constructive criticisms about the retreat. Comments?
Chris, I would just emphasize, I think even Monty at the end, throughout the question or comment about like, does capacity building need to be a fourth pillar? I mean, and I'm not advocating that we make it a fourth pillar, but just an emphasis that came up a lot. So that bottom right bullet, I think it's important that we really look at how we build that out and build that in a way that builds our equity muscle, right? Which, personally, again, I would advocate looking at how are we bolstering those organizations that really could use capacity building, and thinking our community-based organizations to lift them up so that they can better partner in this work.
Yeah, and people have thoughts about anything, but including about that. Somebody else can say something? Yeah, I'll make a comment that one of the things with the capacity building, and sort of my experience, and I've done, a fair amount of this, is that the question always becomes, well, what kind of capacity are we building? Because it's, there are a lot of organizations, they all need help. It can become, it could, in theory, if you don't do it right, it's endless. Like there's always a need to build up more capacity. So what are our boundaries, and what are we focusing on? What kinds of capacity are we building, and what are we prioritizing? Definitely doable, but I think that, in my opinion, that's the discussion that we need to have. Any other comments? If not, I can move on and talk about what we're going to be doing regarding community engagement.
This is Molly. I just wanted to again stress how I think that we need to collaborate with more sectors within the North Central region. There are a lot of holes, I think, in our partnerships, and I'm excited about where we're going to go with this and who else we will be able to invite to the table and have them collaborate with us as well. So,
yeah, and yeah, I would just say, and Molly, you're right. You're very, very right. And Caroline has, I don't want to put it all on you, Caroline, but you get part of the answer. I mean, the Visible Network Lab survey that we've done of the entire region is going to help at least be a something that helps us with that. It's not the answer to everything, but it's going to help. I should mention, Caroline, I don't know if you've mentioned this to the group. It's one of the things that we found in doing the Visible Networks Labs survey, is asking, you basically had started off with a set of organizations that Caroline very laboriously developed, like, who are we sending this survey to? And then you ask the people who responded to the survey, okay, tell me about the other groups here. Here's a list of all the groups that are receiving the survey. Tell me about them. And then also tell me about groups that aren't on here that you think are also key connections for you. And there were a lot of organizations that got named, new ones that we didn't have in our original set. So that's pretty cool. Who are these new groups, and how do we characterize them, and how do we bring them in? Caroline, is that a fair? Tell me if you think that's not, okay, you're nodding. All right, that's good. I was hoping I got that right. Okay, so let me talk about community engagement. Because when you do this, it's a lot like it seems like a great idea. Yeah, we should definitely do all these things. How do we do it? What is our actual method for doing any of this? Actually, I'm going to skip over this one because we've mostly talked about this.
Chris,
Oh, yeah.
actually, can you share, go back to that last slide? Can you
Yeah.
share about our discussion around the vital conditions?
Oh, yeah. No, you're right. I knew there's a reason why I put this in there. Yes, thank you, John. So the vital conditions are, we've talked about it. They've come up at a couple of different points. The strategy work group has kind of dug into them a lot. It's essentially what it is. I mean, there are a lot of ways you could talk about it, but it's sort of a further evolution of the social determinants of health. And basically the social determinants of health kind of tell us that we need to care about more than just what goes on in health in emergency rooms and in hospitals. We need to care about the things that are not medical care. What the vital conditions do is they kind of give you a way to grab hold of that and decide what do you actually take action on and how do things fit together. So it's a set of seven conditions. In fact, I do have some slides in here that I could come back to. If time allows, I'll go into those in more depth. And if not, if time doesn't allow the I think it would be great to come back to it at maybe at the next meeting or the meeting after that and kind of dig into it a bit more. Because one of the reasons is we talked at the meeting, at the retreat, about we want to have people thrive. What's that mean? The vital conditions kind of give you a way to organize an organizing framework for moving people into thriving, for understanding why people are struggling, understanding why people are suffering, and then figuring out what steps you can take to help them thrive. So I'll, if time allows, I will show those slides because they're interesting. And if not, like I said, we can come back to it at a future date. Is that good? Okay. It's important. They'll factor into the compact. I think we had a good discussion about them at the last strategy work group meeting last week, and I think they'll factor into the compact because it's just, certainly in my experience, it's really, really helpful to have an organizing framework. Otherwise, it saves you from getting lost in a million different options. Okay. So what we want to do with community engagement is we want to engage organizations and partners. We want to build relationships that either deepen the trust that's already there or repair an absence of trust. Things have happened over the years where trust is eroded between groups, between organizations, between sectors. We recognize that, we're very candid about it. We say, here's what the problems are, and we figure out how to repair that so we can build up the kind of trust that's necessary for making real progress on anything. We want to sort of familiarize everybody with our mission and our pillars and gather feedback about them. Like, what do people think? Are we doing the right thing? I mean, are we missing something? And so on. And just gain listen and learn and gain new perspectives. So when you do the community engagement, one of the things we want to avoid, we want to do that second bullet where we talk about what we care about and what we're doing, but we don't want it to be just one big advertising session for us. We really want to hear from other people about what they care about. And then gradually we want to strengthen the capacity of everyone, including board members, to be able to connect with the community and to practice distributed leadership. So this is sort of our first step towards saying, okay, here's what distributed leadership starts to look like. It starts to look like this, and I'll show you now. I think we've talked a couple times about dialogue, but it's worth returning to because this really is the cornerstone of what we're doing here. What dialogue does is it creates an environment that builds trust and respect by honoring different values and perspectives. It's not about forcing everybody to adopt your perspective. It's not about convincing people to come on board your train. It's about understanding what they care about. And then seeking just a deeper level of understanding that makes collaborative action possible. So the underlying idea here is that if you want to take collaborative action, if you want to form a regional portfolio, if you want to take joint action on anything, there has to be a baseline level of understanding and trust. I have always found this very helpful to contrast debate with dialogue, to understand dialogue by understanding what it's not, that it's not debate. And the key differences here, I won't go through all of them, but in a debate, you kind of go in like, I kind of know what the right answer. I have the thing that I'm pushing and that I want everybody to convince everybody to adopt. And that's the stance that you're taking. And so you go through if you're in debate mode, the entire time you're talking to somebody, you're kind of maneuvering. You're thinking about, ooh, what's a weakness in what they just said that I can pounce on? And what's a way that I can get people to sort of like give up whatever wrong idea they have and adopt my idea. With dialogue, you're really not in that mode. That you're assuming that you don't have all the answers and that other people have crucial parts of the solution, and you want to find out what those parts are. That everybody has some piece of the answer, and you need all to come together to find what those pieces are. And the goal is to work toward common understanding, as opposed to getting everybody to getting half the people to sort of surrender. As we move into this, as I go through the next couple of slides, keep that in mind, that's what this is really all about. The next to last row there, you're not going into the mode where you're looking at whatever the flaws are and what people are saying. You're trying to find what the strength and the value is and what they're telling you, because that actually helps you. Because now you've learned something new, and now you're stronger because you understand something that you didn't understand before. So we want to listen for what's true for others. We want to share what's true for us. Go ahead. We want to be very candid about this is what we think the truth is, but we also want to know what you think the truth is. And then discover what we have in common so that we come to a common shared understanding of the truth. And I'm going to pause in a second because we've actually started to pilot this, but I want to sort of explain more about what this is, and then we'll hear about the first pilot. So again, sort of another way of talking about this. What we want to do is we want to launch a series of dialogues around the region, and sort of create opportunities to hear from people, including people we haven't heard from before. So we want to talk to people we've already talked to, who we already know, and maybe talk to them in a new way that gives us a new perspective on their positions and their beliefs and so on. And also talk to people we have not been familiar with before. There's also the second one down there, community care events. You can call them anything, lots of things, but basically you have an event. So in a dialogue, you bring people together and you talk about important questions. In an event, basically you share something, like for instance, you share like a really interesting documentary or something like that. And then you get people's thoughts about it. You could say like a film screening or something like that, where you're really pivoting around a very particular thing that everybody shares together. So we're interested in doing both. The focus right now, and what I'll talk about, is about the community dialogues. We have some ideas for community care events, for shared screenings and so on, but I won't talk about those today. So here's what when we're talking about the dialogue sessions, here's what we're talking about. Small groups, 5 to 8, and really more toward the 5 side, like 8's kind of pushing it. You can have a larger group that you break up into groups of 5 or 8, and then the actual discussion occurs in small groups. An hour, maybe an hour and a half. Ideally, it means tapping into partners' existing schedules and structures. So part of the idea here is that when you have these dialogues, generally you want to understand, like, hey, when do you normally meet? And let me come to where you are at your time. Rather than telling people, well, if you want to talk to me, you better, come at, Thursday at 2, you want to accommodate to other people's schedules, and the kind of structures that they already have. So you're folding into their current practices. Very light touch. So when we talk about board members learning to do this, I have to emphasize that it's not, when we talk about learning, it's not that much learning. This is a very, very light touch facilitation that we're talking about here. Talk with, as I mentioned before, both existing partners and trying to open up new relationships with people. And importantly, that last bullet, if this works well, I mean, it's a hard thing to pull off, but when it works well, you hold a dialogue, and the people who come, one of them says, hey, this was cool, let me have one. And so then it starts to spread. So you start with whatever your initial group is, you bring people in, they have productive dialogues, they want to have others, and then it spreads from there. And that's sort of a network effect that starts to take hold. Okay. So we have two guides here. I won't go into them. I don't think we have time for me to go into them in detail, but we have basically what we're calling our, 101 and our 201. So they're different levels of depth about, so the first one is having a dialogue about what does it mean, what's well-being mean? What do we mean for health and well-being? Like what's it mean to you? What's it mean to you? What's it mean to you? And then in the growing our network, we're talking about, okay, what do you care about? Like, what do you want to achieve? What's really important to you? Let's talk about those things. So this is where I'll pause to say that, to ask anybody who earlier today, just a few hours ago, we did a first pilot of this. I didn't attend. I'm curious how it went. To anybody who did participate in that, anybody want to say something?
I actually did this with the WPCC. We kind of came back together. We haven't met since December last year, and we're going to regroup again today. So this actually went hand in hand with what we were going to do anyway, and we chose the 201, growing our network. And I thought the process went really well. We probably didn't allocate as much time as we could have, because we were just really piloting it and folding it into the other things that we were going to do, and then having the come back together and discuss it all. But the format went well. It was some complex questions, which, when there are a lot of them and the questions themselves are very complex, can lead you in many different directions. So, and I think part of it's designed that way to allow those who are participating to take it in the direction that's meaningful for them. So as we're not pulling them into a box in a focused area, instead we're drawing out the ideas and themes from them. So I think, John, you could probably expand, and Mariah as well, who was on that call. But I thought it went really well, and it was a great conversation in the room that I was in.
Yeah, John and Mariah, do you want anything you want to add?
I'll just say, like Wendy said, we did the 201, so growing our network, and the people felt like those were pretty meaty questions. So that, they were saying that for our general community, it would probably be better to do a 101, which Wendy told them there was a 101, which worked out perfect. But I think it's like, it's interesting to start hearing what people's priorities are and how those priorities rise to the top. And then what will be, like, to me, interesting is how it synthesizes into like key themes across our region. Like, Chris, I think when you looked at that dialogue and debate slide, that first topic where we don't want to go through input and dialogue where we're just basically going through a process which confirms what we already think is correct and make people just verify our corrections. It's really important to go through a process where people can share where they think the areas are of improvement, where the issues are, so that they can really start being part of that co-creation process. And it's a hard needle to thread to provide enough direction to give them the discussion, but enough, flexibility in the discussion that they really share their thoughts.
So let me show you, thank you, John. Let me show you what, and this is the last slide before we take a break. So basically, idea is piloting and refining the guides and beginning to schedule sessions right now in August. I mean, these are approximate, of course, but then roughly toward the end of August into September, you get ready to actually hold them, which is what you see there in the fall. In the middle, the second bullet there, in September, what we're planning to do is at the September board meeting to train board members in how to host a dialogue. Again, I'll stress here, this is light facilitation, and it therefore is a light training. I mean, this is not, I think one of the most important things, like, no two dialogues are alike. So it's not like you're trying to execute some perfect plan and everything has to go exactly right. That is not what it's about. Basically, you just get people talking, and every time it's a little bit different, and that's great. It's more, a lot of it is about the experience of getting people, of being able to talk to one another. So we'll have a light training, get everybody comfortable with how they would do their own. And then, sort of, we would begin to schedule them and then begin to hold them in the fall. And then toward the late fall, after we've done some, we'll start to talk about it. Okay, what have we learned? What are our takeaways? There's a sort of a light tracking or document. Basically, if you host one of these, you kind of fill out a few basic questions afterwards. We're not trying to get everything verbatim. We're not trying to get every last thing that somebody said, but like, what are the main takeaways? What have we learned? And then to discuss what those takeaways are and have those influence us. I mean, part of the point of this is to be influenced. So what's it tell us about the compact? What's it tell us about how we should plan for next year? And then these things go on. I mean, this practice of dialogue, we can make a 301, we can make a 202, like there are lots of different dialogues you can have on different subjects, and they can evolve as we go. So let me stop right there. Questions or comments, objections to anything that I said?
I was just private messaging Caroline about the Colville tribe. This would be perfect for them and their Health and Human Services division. And it's diverse departments to get all of their insight, maybe do a 101 and then a 201 in November. In December, do strategic planning for 2023. And that's just a logical way for us to start out 2023 is, so I love this idea, just for my segment. So
yeah, I'll say one of the virtues of this is that it's not over planned, right? So you basically get a dialogue, you get a guide, you try to loosely follow the guide, but what it's sort of to lower the barrier to entry and the anxiety that can come with, okay, we've got to talk to people, we've got to figure out how to do it. And so you end up never doing it because you're just so anxious about it, I'm going to do it wrong, or it's going to go, I'm going to trip, and all this sort of thing. And what do we, it's not, the idea is it's just a nice, very easy entry into getting people talking, and then you just keep going.
good coffee and pastries and
Right. That's part of the.
It would really open them up for good dialogue.
Sure. Yeah. Okay. I think, John, am I right about the schedule that we have a break?
Yeah, one question to consider board members maybe as we think about training in September is, like, besides just the dialogue training, what other things do you all need to feel comfortable going into these dialogues with community members? We are asking board members to be part of the dialogue and help facilitating it. So what are additional things that you could need to feel comfortable doing this? Knowing, I'm going to throw the caveat there, right? We're also asking if this is something that you're new to allow yourself a little level of discomfort and experiment with it as well, so that we want everyone to get this a try, not just those who are completely comfortable jumping into dialogue conversations. But we're here also to support those of you who need extra education or training around how to do dialogues. But that's something to think about, probably at least for the next board meeting. Deb, I don't know if you were going to say something.
I was just thinking we can partner up with different sectors. So someone else could jump on with me, behavioral health or something with the tribes, and it just brings more of a voice and different ways of looking at things. To kind of partner up.
I think one of the cool things that we could talk about in September, Molly, would be kind of setting up a buddy system, like, so that you don't have to do one. It's a kind of better if you have somebody else there, just logistically anyway, and just like doing something together, partnering with somebody, following along, especially if you bring different strengths to it, as you were saying. So that's one of the things that we can talk about, particularly, and also if you're like, this kind of thing makes you anxious, you can partner with somebody who's like feels a little more comfortable doing it, and then eventually you become equally comfortable. Okay, break.
Break time. Okay. And we come back. It says 2:05, so 2:06-ish.
Perfect. We'll be back.
All right.
Okay.
2:06. Thank you. Recording. All right, we'll go ahead and continue on with the board governance survey.
All right.
Chris.
Hello, everyone. So we want to do is when did actually, John, remind me, when did the survey go out?
We did a survey in June, beginning of July, around board governance, and I'll add a little bit of details. So last year, 2021 was the first time we did a board governance survey, and you guys can maybe all remember we did it with Mike Bonetto from Tenfold originally. And then he did at our July retreat 2021. He reviewed the survey, and then we talked a little bit about board governance at that point and looking at the difference between operational boards and policy boards. And so one of the recommendations when I've had conversations with board members this year, and probably just a good practice to continue annually, was to survey and evaluate the board. And so this year in June, July, we did another board governance survey, same one, but we added a few questions because we wanted to add a few additional questions around health equity. And Chris is going to review kind of those comparisons over the last 2 years, and also just kind of focus on that conversation on how we can continue to evolve as a board for better governance. We are also looking at, and one of the recommendations was to do a monthly or quarterly board smaller survey or meeting evaluation to look at continuous quality improvement throughout the year. But this is kind of will be our annual board survey where we really look at, okay, this last year, how have we really operated? How have we really done, and how can we make improvements? We would traditionally have done it at the July retreat, but we were pretty packed in the July retreat, and we really wanted to focus on really that strategy component and have community members as part of that strategy component. So that's how it ended getting moved to the August board meeting. So with that, now I'll turn it back to Chris to review the survey and open up the discussion on it.
Yeah, so this will be in 3 parts. One is that we'll look at some charts that show the results. Second, we'll review some key comments and ask for people sort of to comment on the comments, or elaborate if they're your comment, to elaborate on what you had in mind. And then we'll ask some questions. We'll just some discussion points for us about the board's current state and where you want to be headed. And I will give you, before we start, I'm going to give you a spoiler because I don't want anybody to be disappointed. It is one of the main takeaway is that the results from 2022 are very similar to the results from 2021. So we have not had a lot of change across 2 years, but we'll look at the details right now. Let's see, did that work? I'm not sure it worked. Let me try again. There we go. Is that good? Can people see that? Okay, great. So this is you can see the first one was how long you've been on the board. And obviously there's some of you are new. And so that shows up here. Just notice the key there on the right. So 2021 is the reddish color, and the current year survey is the greenish color. So anyway, so some change in terms of how long people have been on the board. I guess in one way to look at this, we have fewer new people this year than we did last year, but there's definitely some change. So very similar results when asked to talk about North Central ACH's mission. You can see that the question prompt there at the bottom is, how well do you align with these things? And so we could see both this year and last year, very similar results. So it's a scale of 1 to 4 or 0 to 4. And so 3.5, it's really great. I mean, generally, I guess I should say, as we look at these results, rule of thumb, anything above a 3 is generally pretty good. Like that means things are generally good. So we want to anything. So if something is substantially below a 3, okay, we want to understand why that is. Okay, so that's alignment on mission, very strong. When we asked about board governance, again, very similar results across the years. I mean, these differences are pretty much they're basically tied. I mean, there's really no significant difference between where those bars are across the 2 years. And you'll see all very close, either at 3 or very, very close to 3. The fourth one is slightly below. That also is not a statistically significant difference. So really they're all about the same, all hovering at 3. So generally, takeaway here is a pretty good, it's not like, stellar, but still very, very, very solid in terms of the answers to these questions. Next one. So when we asked additional ones, so there are additional 2022 questions. So you'll see that we added the other 4 questions in 2022. So there are no comparisons for 4 of these 7. Of the 3 that were asked in both years, those also, again, were very, very similar. It'll be interesting to see next year if there's much change here. But the 4 that were added are sort of have an equity orientation to them. And the ratings there, again, were pretty solid. The board meetings and the decision-making process, which is often a real sticky subject for a lot of boards, is solid as well and has remained solid across the last 2 years. Slight improvements, but again, the differences here are so small, I wouldn't even read them as improvements or declines because they're basically the same. Okay, so very solid results. If you had to give the board a grade today, what grade would you give it? And you see this is in 2022, we have, that difference yet again is not actually, I wouldn't read too much into the difference between them. We have in both years, I think it's one response that was D in both years. So one very low response, and then all the rest being pretty high. So that's pretty good. I mean, if you're doing an A or B, that's generally considered, that's pretty solid. So one of the things that I'm going to ask after we look at the comments is, okay, how do we get from a B to an A? Those of you who think that it's a B, what are your thoughts? Like, what would make it an A in your mind? So we'll talk about that in a second. But I want to talk about a few of the comments. We have 2 slides of comments. So three comments per slide. So take a moment to read those. These are just sort of I selected sort of really particularly key comments. Read those and see if you agree with them, if you disagree with them, any comments you have. Okay, if one of these comments is yours, and odds are that that at least the original commenters are on this call, there's a good chance. Go ahead, elaborate on it. Say anything more that you'd like to say, and then second, just whether it's your comment or not, what do you think about this? I mean, is there anything here you agree or disagree with? Okay, and I'm going to just go through them one at a time because I am curious. So. We're spending a lot of time on the process of decision-making and collaboration, and not a lot of time on actual collaborative projects. Any thoughts about whether that's a fair critique, whether you agree with that critique, whether you think it's an unfair critique? All right, if there are no comments, we'll assume that it's an uninteresting critique, whether you agree with it or disagree with it.
After you unmuted, were you going to comment?
I was just wondering what, I'm not sure where the comment came from, but what we would look at in terms of actual collaborative projects that the board would be working on. Are they talking about collaborative projects around board development or collaborative project work of North Central ACH?
Yeah, it's a good question.
I'm not sure.
Yeah, I mean, I agree that it is ambiguous. If the person who made the comment is not on the call, well, if you are on the call, please elaborate. If not, we'll have to just leave it as unknown. All right, then there's the question about agendas need more substance relative to strategic priorities with informed deliberation. We spend too much time on some areas and not enough time in other board relevant issues. Comments about that? Does that resonate with people, or you think like, I don't really agree with that? All right, if there, I get, my interpretation would be if you have a single comment and then we discuss it on the call and nobody really seconds it or kind of piles on it, then we would kind of take this to be not a major issue. Like we have one board member who thinks this, but if other people on the call aren't really fired up about it, then we'll assume that it's really not a major consideration. And then the third one, yeah, so the elevator statements one is interesting. That's a little bit what we're trying to get to with some of the activities that are going on for the rest of the year. That is one of our goals, is to both with the dialogues and then the construction of the compact. The compact, if it's done well, is basically kind of compilation of our main elevator pitch statements. So I think we will be making progress on that. All right, if there are no further thoughts, I'll move on to the next set of comments.
Can I ask, Chris, I may reference it in a different way. It sounds like some of these comments are kind of linked together in the information that is coming to the board. So I'd be curious, is there information you feel like that we could better provide to you all as board members to help make decisions strategically? Is there information you feel like we're providing too much of? If to help alleviate these comments versus directly asking about these comments, what is probably one or two things you guys see based on these comments that we could improve upon as a board?
I guess, I mean, I'm trying to read into these comments. I think, do we feel like does the board feel like we need more stories of what's happening with the data to say, oh, we're making improvements here and not here? I mean, is there not enough of that? Because I feel like we're in that spot of like creating vision, still creating kind of our identity, trying to figure out our identity, and then moving forward from there. I don't know. I guess I'm asking the board, do you guys feel like we need kind of more measured datas of like, here, this is where we're at, and we're at a 9 on this, and we're at a 2 on this, and here's some stories to show you what that looks like?
Ray, oh, sorry.
Oh, go ahead, go ahead, Carlene.
Yeah, Ray, I just wanted to say that's for me. I didn't happen to be one of the people stating this, but I agree with that. For me, I don't want to spend 2 years figuring out doing the fluff of things, or I mean, it's not fluff. I shouldn't say it that way, but really it's about getting our ducks in a row and then seeing what it produces, right? And you're right, the stories, what's happening really is what's really important to me. I would rather spend my thinking time around what's happening in the community and how we're making a difference there than yeah.
Yeah, I kind of get those stories at the chais. I mean, at least the Chelan Douglas chai, I get more of those stories, and like, here's some more relevant resources. I don't know if that needs to be happening also at the board level too, I guess.
This is Molly. Some of the places that I have found the stories, LinkedIn NCACH has a great presence on LinkedIn. Tweets, I get tweets off Twitter. They just ping my phone. So, I mean, there's some storytelling going on out there. There's a Facebook presence and Instagram as well. But LinkedIn seems to be a great place to find out what NCACH is doing. And myself as board chair felt like I needed to get, there were things going on I hadn't heard of. And I was like, what's going on? Then I started paying attention to these items that are popping up in my news feeds, and it helped. So just an idea that was something I noticed.
Well, I can comment on the third bullet because I think I wrote it. So going back in my head, but I think we already provide data. I mean, that's why I wrote continue, because I think we're providing, I hope, data on projects, more about like successes. I think it's good to bring successes to the board, whether it's specifically stories or just percentage points, or kind of so that we are able then to turn around and describe very clearly, here's the benefit of North Central ACH. These are some of the these are the positive outcomes that this agency has provided to the community. And I think the best way to do that is through data, and data could be stories or data could be numbers. It's all data, and to have some just continue to be able to provide that kind of information to the board moving forward, so we can share it out too.
And Kathy, with that too, I would like to know what didn't work. If we tried to do something to just for our own knowledge, so we're not, so we know what direction to choose. Yeah, thank you.
Yeah, so I'll thank you, everybody. I mean, so we'll have some, as I said, we'll look at one other set of comments, and then we'll move to sort of just a broader discussion on a few different key questions. But that's really good. And Carlene, I completely agree with you. I mean, if you never fail, it means you're probably not being very ambitious. I mean, you're going to try stuff and it's not always going to work, and you want to learn from it. And so that learning process has to be, it's pretty key, it seems to me.
So could I just quickly summarize maybe a little what I heard was the kind of, I think as we've been doing the strategic planning, we've maybe gotten a little too focused on strategy and long-term planning. And we need to kind of bring it back to outcomes and individual stories. And now we've had even partners come and talk about the projects and success, and board members would love to see that reintegrated back in as a focus this next year, because that really helps also inform strategy.
And I mentioned it like a little while ago that we're launching a measurement task force, that Sarah is going to lead, and that's also part of it too. Because in some cases we don't have the data that we would like to have. We don't have the stories. We don't have access to the data that's really the most informative, and that's something we want to figure out how to address. Okay, so I'll just let me in this case time I'll just read them. So we need to define strategic goals with timeframes and tools for evaluation of progress. We're spending way too much on consultants for things staff are very capable of doing. Next, NCACH is doing well in Washington compared with other ACHs. That being said, we need to continue learning and growing in the understanding of our mission. And then third, as our board grows and changes, I look forward to more people of color put in place. So as before, I'll just say, like, anybody have comments about, anybody want to, if you wrote it, if you want to elaborate, or if you have opinions about any of them. All right, we'll keep these in mind. So I have some questions for you. And so let me so sort of keep these in the back of your mind, see if there's anything you want to say about them. So what do we like about the board as it currently functions, and what are some things we could do to improve the governance? So does anybody, like, what, looking at that last one, what do you not like? Is there anything like, Ben, I wish we just did this one other thing differently? Is there any kind of comment about that, about something you would love to see changed, either in the near term or the long term? And also, if there's something you really love, please share that too.
I like the routine. I think Molly's done a really nice job as chair. I like her approach, and I like the approach of the staff to the board on it's predictable. I like that continuity.
I know that at one point in our earlier discussions of this transition year, we talked about the number of board members on the board, and did we need to increase it, add different sectors? And so I'm curious and want to always keep that in mind. In reviewing and looking at some of the other organizations nationwide that are similar to ours, some have small boards and large committee groups, and then some have very large boards that are all acting committee members. So I'm just looking to see what the best fit is for us.
Yeah, in fact, I'm going to jump ahead because actually that's one of the questions I had, but it's at the end. So let me just go through a couple of these. So one of the questions I had was, how does the board need to evolve over the next, I've said 2 years, it could be any period of time, but how does it need to evolve? So should board membership be less about representing constituencies and more about representing perspectives? Like, you know, what do y'all think? And are there changes that we should start on now? So that's, to me, Molly, that's asking a similar question to what you just asked. And that's ultimately, that's a pretty important question. I'd be very, very interested to know what people's thoughts are about that. Do we have the right perspectives? And if we don't, how do we add them?
I know the homeless or housing itself has always been a sector that we've talked about and having in place.
I have a question for John, a little historical perspective for me. Has the board been reorganized with different sectors or reducing the number of healthcare facilities on the board, for example, now that your work has changed so much?
We haven't done like a real review to see if we should restructure the board. I think the biggest change we had ever made was when we added the CHI seats, the Coalition for Health Improvement seats. Those weren't originally, my understanding, structured to be on the board. And we added those probably 3 years ago, if I'm not going to get the date correct.
Sure.
But since then, we've always had this discussion, like the topics always come up. We need to be more representative as a board. We need to be less healthcare centric. The Medicaid transformation project required a few clinical specific seats, but their general obligation was not to have a board with no more than 50% clinical representation. And you can splice that how you define clinical, right? If you're on a Coalition for Health Improvement seat, you may be a clinical partner, but you should be focusing on your region, not your organization as a whole. So the representation and who you're representing also impacts that.
Now, then I'll kind of echo what Molly was saying, is kind of looking ahead to the work that we're doing. I think we should always be asking who's missing at the table. And I think as board members with our respective groups, we should be asking that same question: is it necessary for there to be so many of us at the table, or should there be somebody else at the table? When you come to us as board members to get direction, guidance, somebody missing? I think more importantly, is there somebody missing, or could the vote sway it in such a way that's it's not appropriate for that work, but it might really benefit a certain sector, especially when we're talking about funding allocations?
Yeah, what do people think about that? I think if you try to construct your board where you like check off every possible group, right, you end up with a group that's 100 people, right, or more than that. Like it becomes unworkable. So it can't, in my view, like that's just like you can't do it that way. So the question then becomes, well, who is on the board then? And what is the kind of, you're always just having to decide, I think, what kind of diversity you care the most about. You can't have complete diversity again because it just becomes too big. So what kind of diversity do we choose to emphasize?
I'll comment just quickly, Teresa. I mean, I'd want to shout out to like public health who kind of went through you guys kind of went through this experience or going through this experience right now, right? Like where you guys were required to add additional diversity to your board seats, and also the tough conversation of do we really want to just double our board? So that means you're hanging out in a room talking to people who some of them may no longer be board members in the future because you're trying to balance out inviting everyone to the table and having a 40-50 person board to having a smaller group that can be a little bit more nimble in their decision making.
Yeah, it was a very difficult process because the people that had to help me go through the process were the people that were being kicked off the board. And so and the ones that did double the size of their boards, it's a different level of, it's a different challenge for them because they've never operated with that size of a board. I mean, this is a pretty large board too. So kudos, I think that's a lot to have to manage and keep informed. And so it's, definitely not advocating for a huge board, but I did think about our reorganization when I saw that comment come up. And when you have community members that are representing ours have categories. Board orientation is so critical because, a lot of us, this is our day job. So we serve on other boards. We're familiar with the process, but when you have community members come on your board alongside people that do this professionally, it's finding that balance so their voice isn't lost at the table and that they understand the process and they don't feel like they're not as valuable because they don't know the process. So it's, board orientation is real critical for community members.
Molly, you also kind of brought up the idea of like, there are places where you have smaller boards, but then you have other kinds of groups and other ways to contribute. So is that also a path, that you, because you never can have everybody, do you try to just make sure, ensure there are other ways for people to contribute? It's not as if you're either on the board with a voice or you're off the board and you have no voice. There's other ways.
And noticing that more with us in this last year, some of our committees we are bringing in, or the strategic work, whatever we have outside.
Yeah, that's a good point. This strategic work group is a good example of that. That's right. And in a larger kind of sense, that is what we're trying to do with the discussion we had earlier about the dialogue sessions and everything like that. Having different ways for people to contribute. There's not only just one way. You're either on the board or you're not. And having that's what distributed leadership is about. So on. All right. Further thoughts about this? This is a big philosophical question. If you have a strong opinion, don't hide it.
Can I just maybe to spur a question to wrap up maybe a next step around this is we've always philosophically said we've wanted to change our board, but we've kind of been delaying a little bit because we said, we don't have enough information on our future strategic direction or strategic priorities, so we don't know who to invite to the board. I would say, could I get just a general sense unofficial poll, how many people think that we shouldn't be delaying and we should be really spending the rest of this year looking at how we would restructure our board or reallocate seats? Give me a thumbs up or a thumbs down if you think we still don't have enough information to make that decision. Yes.
John, that's a tough question, for me anyway. I guess what I feel that what would help me is to get clear on what is our end goal 1 year, 3 years from now, whenever, or by the time this grant ends. What is the end goal, and getting a sense of a good grasp of that, and then in my mind I could work backwards and be able to give you some thoughts on what we could do, what steps and milestones we should be trying to put in place to get us to that end goal. But I don't know what that end goal is yet. I mean, I feel like we're going through a really good process of gathering input, ensuring people are feeling engaged and participatory, which is good. But I think that we really don't know our destination. I don't know that we have some conceptual frameworks that should lead us towards something, but we haven't defined that something in my mind. And so it's really hard for me to really respond to these questions that are coming up today, because I don't know where we're heading.
Yeah.
If that makes any sense.
Yeah.
Mm-hmm.
Other thoughts from, I'm gonna pick on a few of the quieter board members that haven't spoken as much. Thank you, Jesus, for that. Any other thoughts that have kind of come up for those who have just been kind of listening more?
Well, I like the direction that we're moving right now in terms of incorporating more collective impact type work into the board. So we're really starting to look now at what is our mission, what are our goals from a long-term standpoint, going back to what Jesus is describing, so that we're all involved in deciding what are the goals of the group, so we all know where we are going. And I think that that's a good process. I would hate to see us start changing around membership of the board, because it seems like the intent of what's been going on over the last 6 months is really to develop board members, is to really bring everyone up to the same kind of thoughts around which direction the board is going and what are some useful tools, and start developing work groups and things like that. And if we begin now to transition people around off the board and new people on the board, then we would definitely need to have a good orientation process for them, because now we have to bring new people up to make sure we've included all this training for them as well. So that would be my only thought on that, is this the time to do that, or should we continue to make sure that we have our well-developed plans in place? And then look at, well, what is the makeup of our board? And does the makeup of our board, is that going to get us towards our decided plans? Or do we need to then adjust and have perhaps more work groups, a smaller board, but more defined work groups doing, providing some assistance?
And I think that maybe there was a conversation with John and Linda and I back in December or so, knowing what this interim year would look like, knowing post MTP what was going to be happening, or surmising what was going to be happening, and knowing that the board was going to have to come along with us to that. And it's not clean, it's not fun work. It's getting in there and looking at each word. Is that the correct word to use in this instance? It's hard work. And we knew that we were going to take this year to do that work. And probably, being a little more transparent with the board, saying, hang on with us. This is important work, but we're almost, we're getting towards the end, and we're a lot of work will be done today just by you all being candid and letting us know what you're thinking. Yeah, it's probably should have told you all in January to hang on because it's important.
I don't have the today's agenda in front of me. How much time, when are we concluding this?
Next session starts at 2:45. That's the
Oh.
board member application.
In 2 minutes. Great. Okay. So it seems like that sounds like we're done. All right. Well, thank you everyone for, these discussions are always, they're, you got to keep having them. They're never simple. So thank you for letting me share all these results, and, it's not the last time we'll talk about this. I will turn it over to whoever's in charge.
Yeah, me. I guess I'll be in charge. Thank you, Chris. That was
Yeah.
great. And I'm sorry we ran out of time, but
Yeah.
we'll bring it up again later. And anyone who has any thoughts, please let Chris or John or myself, someone know what you're thinking. Please be candid and let us know, what's going on. But at this time,
Molly, quickly, Chris, we'll be able to share your slide deck out with those questions as well, correct?
Yeah, you're right. And so, yeah, as absolutely right. And so, I think we all have the experience, like it's only later that you think of what you should have said or what the thing that you really care about. So yeah, do follow up in any way that's comfortable to you. And we can always even have a follow-up conversation if you want.
And we try to utilize Chris because he's outside of the organization. So he also is able to play that level of anonymity, if I'm saying the word correct, sorry. So that anything that you guys share with Chris, it would be considered confidential as well. So we're really looking for feedback and improvement at a board level. So if there's things and comments you have that you don't want to share in public, but you still want to make sure that we consider, I would again encourage you to reach out to Chris, and he can synthesize comments in a way that would be more generalized to help on it.
We've done that a few times, and thus far, I don't think anything bad has happened. I mean, I've maintained confidentiality and all that whenever we've done that. So yeah, feel free to do that.
great. Thank you, Chris.
Thanks.
All right, now I have Ken Sterner and board application and board member expectation documents.
And I want to also thank everybody for the conversation. It's been interesting to listen for the last little bit here about everything, because what we've really been talking about is process. And process is so important in most organizations on what we do, especially for an organization like ours, representing so many different sectors, so many different people, so many different points of view. And the way we work through how we come to decisions generally is focused on process. And that is one of the things that I think is come to our request for a board decision today. And that is, how do we select board members, and what kind of questions do we ask? And do we ask everybody the same thing? You have before you right now on page 42 of your packet, the board decision form, and what we're trying to do in terms of sector representatives, but also for those representatives who are outside our sectors that might play a role with what we do and what we do in the community. And how do we go about interviewing them? How do we go about letting them know what we do and how we go about our business? And certainly that process, it can have a long-term effect, both how we work, but also how the public sees us and how the public sees the work that we do, and whether it's inclusive or sometimes exclusive to a certain extent. And so in regards to the board decision form, we're going to ask you to approve that today. But I also want to go back there and have you take a look at page 44 and 45. This is just a governing board application, trying to keep it as simple as we possibly can. And that is just finding out why would they like to join us, and what's their experience been, what skills can they provide, what they hope to accomplish, and and after that, it's anything else that they want to know, and vice versa. And so this is the process that we as a nominating committee would like your buy-in to doing this, so that you know that whoever goes on the board or whoever applies for board membership, whether they join us or not, are all being asked the same questions and going through all that. To quote Martin Luther King, we are definitely looking at judging them by the strength of their character. And so with that in mind, we would certainly entertain any questions that you might have you take a look at that board approval form, and I'd be happy to take any questions.
Ken, is the updated, is the new mission statement reflected in there somewhere?
I don't know that it's got the new mission statement in there, but that's something that I wouldn't have a problem adding.
It's under the board expectation, member expectation sheet.
There.
You go
Okay,
down.
thank you.
Okay, thanks.
I missed that. Yes, there is. Any questions at all?
Ken, can I just, I know I had shared with you Kat Latay's
Sure.
comments and feedback. I might just read them for the board, if that's okay.
Go ahead.
So I have two suggestions to better reflect the intent of sector and CHI representation. So bullet one, in application, add question, if representing a sector or a CHI, how do you engage with the sector and or CHI during your board tenure, and how will you share board information? And bullet number two, similarly with the board member expectations document, if representing a sector and or a CHI, you are consulting with your sector partners and or CHI partners regularly and sharing information about NCACH. So the first question really is just how would you report back to your sector as a broad, as a whole, and then the expectation is actually saying that that's an expectation initially, that you would go back to your sector and gather feedback. And her comment is, I think these questions are important as we consider distributed leadership across the board in the region to ensure those that are within the governing board space are actively engaging with their sector partners and community. So she was asking for those modifications to be made.
Are there any comments to that or suggestions? They seem reasonable to me. Thank you, Carlene. I appreciate that. I think then I would modify then our decision form and add to it that we add those two suggestions to our list of questions as well. So when we vote, those two we will add to that. With that in mind, I will bring that forth as a hope I will nominate, or not, excuse me, not nominate, but we would like to bring it forth for approval, and I will make that motion. Looking for a second.
I'll second that.
Thank you. Okay, Ollie, we have a first and second. And you're muted.
You did, okay. So now I know how long my battery lasts on my laptop.
There you go.
I'm back. So we have a first and a second. Any discussion at this time? Last chance for any questions answered. Hearing none.
I don't have a question. I just wanted to say, Ken, I appreciate your work on these documents and others who put these together.
Thank you very much. I was fortunate to be able to review those documents, and others did put those together, but they did a very nice job. So on everyone's behalf, thank you, Kathy.
Yeah, thank you. All right, so we have a first and a second. So at this time, all those in favor say aye.
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 Any opposed would be nay. Any abstentions? Hearing none, motion carried.
Okay,
Thank you. Thank you, Ken.
Back to you, Madam Chair.
All right. We have just a few minutes before we are going to be excusing all of our guests and going into an executive closed door session. So is there any information anyone wants to bring forward, any news? I will let you all know that my office, Rural Resources, is having its first back to school health fair. And I have invited quite a few organizations to participate. If you want more information, you can reach out to me and I will let you know. It's August 18th from 10 till 3. Be giving out backpacks for our students here in the Lake Roosevelt School District, and healthcare information, more with the managed care organizations, whichever one the children are assigned to. We will let them know what the different options that they have under that carrier. So it could be anything from chiropractors or massage therapy or free phones, those type things. So things that they would possibly be interested in. So that was my little announcement. Anyone else have an announcement?
I believe Teresa has her hand up.
Yay, Teresa.
Hi, everybody. So from the public health districts, we have started our community health assessments and data dashboards. Really excited about some of the products that are going to be coming out over the next several months. But Grant County has launched our community survey. So we're going to be doing some focus groups, community surveys, really asking people what you're healthy. And we'll be adding that in and doing some comparative work with what the great work Confluence did, seeing where there's additional gaps. So I'll put the links here, but if you're from Grant County, please take our survey. We want to hear from you and help promote it. Thanks.
Anyone else have anything that they would like to add for the good of the group?
Well, this is Kathy, and schools are gearing up. So getting ready to head back to school. We're expecting our newest version of the COVID response guidelines. They were due today. So perhaps by 5 o'clock, we might have those come in from Washington Department of Health. So we'll be looking at those and then resuming our meetings with our public health partners and getting kids back to school.
All right. Thank you. Just informed that for this meeting, this closed door session, we need a quorum of 9 board members, and we do have 9 board members present. Hopefully you all can stay on until 3:30, and I promise we'll get out.
Molly, I just made that comment. So you can continue in meetings, you just can't make a decision
Yeah,
unless
it makes the
9.
meeting more valuable, I think. Because,
Yeah, so
yeah, and I don't think we're going to be voting, but.
Yeah, and I actually think we only have 8 right now. Somebody dropped off. I think
There's-
Ramona left.
I didn't mention it soon enough, so that's all right. That's all right. We will still go forward and do what we do here. Anyone else have any questions? Any comments? And if none, Teresa, are we going to go out into a separate? or
Yeah,
just ask? Okay.
yeah. I'm gonna move you all into a breakout room, and then I will just keep the main room open. But then you also have my cell phone if you need
Okay.
something.
Yes, I
So-
do.
Molly, just so that everyone's just aware, I can't remember if you mentioned this. So technically for board members, you are moving into a closed session. It's not considered an executive session since we're no longer subject to the Open Governments Act.
Mhm.
Technically, we don't need to move it into an executive session and come back to a public session anymore. You just have a closed board session. And so Molly's welcome to adjourn the meeting when it's done. There's no requirement to come back to a public meeting and adjourn the meeting in that regards. And again, Molly, you can have any discussion you want. Like I said, you just have to make sure you have at least greater than 50% of the board members present if you decide to take any action. And Ken just squeaks that in when you log back in. There was 8 before. before that. So,
Yeah, I was gonna say, now I have 9, so.
so welcome to have that discussion. Welcome to discuss anything, but just make sure, since it's on that edge, that you're doing that count prior to any action gets taken.
Okay, okay.
All right, so you ready?
Yes.
And then I think you can just all hang up at the